Catholic Health of Long Island is at the forefront of healthcare innovation and community support, delivering high-quality, compassionate care across 6 hospitals and numerous ambulatory facilities. And joining us now is Tim Kelchner, Director of Multimedia Content at Catholic Health. And, we've known each other for a while in this business and stuff. So it's always amazing for you to be here, for us to be able to talk about this. Just tell everybody your role now, with Catholic Health and what you're doing.
I have such a huge smile on my face. It's so nice to be back here. I know, being back at the desk, it feels like old time's sake, Jackie. It's a lot of fun. Catholic Health Multimedia Director of Content. So what does that mean? We have so many different types of storytelling that we like to get into. So obviously our background is in video. We love that. And we just go around throughout the campuses. You mentioned we have 6 hospitals, and we kind of try to find those stories. I was telling you off camera, you did a beautiful story on one of our Gift of Life patients at St. Francis Hospital. And those are the types of stories that our team likes to find throughout the health system. It's those stories of expert clinical care and patients who are in need really finding the help and getting exactly what they need.
And I think, obviously there's the medical aspect of what Catholic Health does, which is amazing. But for you to kind of bring those stories to life, show that personal aspect, the connection between the patient and the doctors, it's so important. And I think then that adds to the level of trust, somebody walking into all of your facilities, being able to see that. And I know that this month's a big month, right?
It is. October is Breast Cancer Awareness Month. It's funny, you talk to our breast surgeons and our breast experts and they say, listen, breast cancer is something we need to be aware of 12 months out of the year.
Yeah.
But it's nice in October because it does get a little extra leverage, a little extra visibility. And that's our top story today that we're talking about. With it being Breast Cancer Awareness Month, there was a new report from the American Cancer Society that indicated that the rates of breast cancer are actually on the rise. Overall, only a 1% increase in the study, which ranged from 2012 to 2021, but some groups were more highly impacted than others. For example, the sharpest increase came from women who were in their 20s. Their rate of breast cancer increased by almost 2.5%. These early onset cancers pose special challenges for providers, as the cases tend to be more aggressive and are sometimes missed because screenings are aimed at older adults. One solution: to lower the recommended screening age.
So recently the guidelines for the United States Preventative Task Force did drop down to 40, which is in line with the Breast Cancer Society's recommendation. But there are discussions going on about decreasing the age to start screening even down to 35. And I do think that that is definitely reasonable considering the rise in breast cancers in women under 40.
And while rates for breast cancer may be slightly on the rise, the chances of dying from cancer have dropped significantly over the past 3 decades, specifically for New Yorkers. According to the American Association for Cancer Research, Americans were 33% less likely to die from cancer in 2021 compared to 1991. New Yorkers were 43% less likely. Now, the big question, what are these declines attributed to? According to one cancer specialist that I spoke with, it's just being more mindful of the disease.
We do attribute that to many factors, including early detection, screenings, and all of new treatment modalities. Also, in more focus on decreasing of smoking and other risk factors have been identified. So we definitely see, and there's a increase in cancer survivors, more than 18 million and more going, and it's a great testimony to what this report is all about.
So some good news there, but it can be a little bit confusing, Jackie, because you have those 2 stories. When I was putting them together, I was like, Dr. Sangal, we're doing another story on how breast cancer rates are on the rise, so how can overall rates? And he was very quick to point out the reason why rates of breast cancer are on the rise is because there are more detections taking place. People are getting screened more often, which is a good thing, so that the cancers are being caught earlier, but it is going to result in more the rates going up.
I'm so glad that you kind of just said that, because in my head I kind of was thinking the same thing, and also just saying, it is early detection. we got it's a reminder for me and other women out there, get those mammograms. It's Breast Cancer Awareness Month. It's so important. It is kind of scary though,
It is, and we talked to Dr. Deitch about, what could be causing those increased rates, especially in that 20-year-old age group. She said there was nothing specific. It was kind of, the same thing. It's diet, lifestyle, but I think people being more mindful will help that out.
You guys provide so many resources, so tell our viewers exactly where they can find more information and learn more about Catholic Health.
Absolutely. Our website, CatholicHealthLI.org. There you can make an appointment with a physician. You can find some of these great stories that we've been talking about this morning. Everything's up on our website, CatholicHealthLI.org.
All right, Tim, thank you so much. Always a pleasure having you here.
So much fun, Jackie. Thanks.
Thank you.